When COVID-19 spread around the globe this year, we wondered how the deadly virus might be evolving as it's spreading across humans. Knowledge about SARS-CoV-2 mutation and genetic variation at both individual and population levels may improve our understanding of disease transmission, pathogenesis, and immunity. This information might be useful in the light of drug design and vaccine development. Therefore, we aim in this study to define key genetic elements, single or any cluster, underlying SARS-CoV-2 evolutionary diversification across continents, and their impact on drug binding affinity and viral antigenicity. More than 12,000 SARS-CoV-2 sequences covering the 5 continents were included in our study. About the half of the sequences were from Europe. Hierarchical clustering analysis was carried out to assess mutational clusters. Structural-based virtual screening was used to select the best inhibitors of SARS-CoV-2 main protease and polymerase among the FDA-approved drugs and to evaluate the impact of the identified mutations on binding affinity for these drugs. In silico prediction models were also used to assess the impact of mutation on epitope recognition. RNA viruses such as HIV, HCV, and influenza tend to accumulate mutations quickly as they are replicating inside their hosts. Because RNA polymerase are prone to making errors, coronaviruses tend to mutate more slowly than the most other RNA viruses, since its viral genome encodes for an exonuclease enzyme with a proofreading activity. In line with this concept, our analysis highlights low values of evolutionary divergence and Shannon entropy across the different viral proteins, indicating substantial genetic conservation. Despite this overall genetic conservation, we identify 35 hotspot mutations in SARS-CoV-2 sequences scattered throughout the different viral proteins. It's noteworthy to mention the D614G in the spike protein and the P323L in the viral polymerase enzyme were detected in more than 60% of infected patients, suggesting that these mutations can confer an advantage in terms of increased viral infectivity. Furthermore, we observed an enrichment of mutations in the serine-arginine-rich motif of the nucleocapsid protein, reflecting the selective pressure acting on this important domain, known to play a critical role in regulating the equilibrium between viral genome replication and viral morphogenesis. In particular, the mutations at position 203 and 204 were circulated with a prevalence over 17% of patients. Other mutations circulating with a prevalence higher than 8% are the mutations at position 504 and 541 in the helicase, and the mutation at position 84 in the ORF8 encoded regulatory protein. Among the previously mentioned 35 SARS-CoV-2 mutations, 16 mutations were significantly associated with each other, thus forming tight clusters of mutations. To note, these clusters are composed by mutations localized in multiple SARS-CoV-2 proteins, highlighting a process of intragenic coevolution. Furthermore, these clusters show a geographically dependent circulation underlying a geographical dependent viral adaptation to human host. In particular, the spike mutation at position 614 and polymerase mutation at position 323 were strongly associated with each other. This pair of mutations also occurs in all continents with a frequency ranges from 15 to 83%. As shown in the red boxes, this pair forms a tight cluster with the nucleocapsid mutations at positions 203 and 204, detected in all continents. Interestingly, in Europe this cluster was accompanied by the continent-specific mutation T175M localized in the membrane region. Other mutational clusters have a unique geographical distribution, as evidenced in the blue boxes. This is the case of the cluster composed by the two helicase mutations at positions 504 and 541 and by the ORF8 mutation at position 84. This cluster was only detected in America and in Oceania. To evaluate the impact of the identified mutations on the drug binding affinity, we applied an in silico drug reproposing approach to select the best inhibitors of the main protease and polymerase among the drugs that have been approved by the FDA. Then we evaluated if the mutations identified in the polymerase and the protease can modulate positively or negatively the binding affinity between the enzyme and the inhibitor. Considering the wild type, the structural-based virtual screening identified 14 potential polymerase inhibitors and 13 potential protease inhibitors. Interestingly, compared to the wild type, the analyzed mutations can determine either an increased binding affinity of a specific drug, suggesting a potential viral hypersusceptibility, or a decreased binding affinity, suggesting a potential involvement in drug resistance. Notably, the polymerase mutation at position 323 reduces the binding affinity of remdesivir compared to the wild type. This reduced binding affinity can be explained by the fact that this mutation reducing the interaction between the enzyme and the drug, suggesting that P323L mutation might act as a natural drug resistance mutation, potentially hampering the full effectiveness of a specific antiviral treatment. The final step was to evaluate the effect of mutations on epitope recognition. As highlighted in red in the table, our in silico prediction models showed 12 mutations reduced the binding affinity for specific HLAs compared to the wild type epitope. To note, a drastic drop in the binding affinity was observed for both helicase mutation at position 504 and 541. This suggests a process of antigenic drift facilitating SARS-CoV-2 escape from T-cell mediated immune response. We also focused the attention on spike mutation at position 614, known to be resided in a recently B-cell epitope. By molecular dynamics stimulations, we observed that this mutation profoundly decreased the stability of this B-cell epitope compared to wild type, suggesting an altered epitope conformation, thus an impaired recognition by humoral responses. This might pose concern for the full effectiveness of vaccine strategies under development and thus deserve further investigation in immunological studies. We can conclude that the identification of key geographically dependent genetic elements, single or in clusters, reflects a geographical dependent viral evolutionary adaptation to human host. These mutations may play a potential role in modulating either positively or negatively viral susceptibility to drugs and in favoring vaccine and diagnostic escape events. For this reason, in vitro studies are necessary to further confirm such in silico based results. In this light, a close and continuous monitoring of SARS-CoV-2 mutational patterns across different geographical areas is crucial to ensure the effectiveness of antiviral treatments and vaccines, as well as the accuracy of diagnostic assay worldwide.